Hey everyone, welcome back to our channel. At the start of the video, I must state that this is for informational purposes and is not medical advice. Today, we're diving into a topic that's unfortunately touched many lives: cancer. It's a word that can strike fear and anxiety, but knowledge is power. So let's break it down and understand what cancer is, how it affects us, the different types, and most importantly, what we can do to prevent it, and what the latest research is telling us. Fun fact: did you know that the word cancer comes from the Greek word karkinos, meaning crab? This is because early physicians noticed that tumors often had claw-like extensions that resembled a crab's legs. Okay, so what exactly is cancer? Imagine your body as a bustling city with trillions of cells working together like a well-oiled machine. Normally, these cells grow, divide, and die in a very orderly way. But with cancer, some cells go rogue. They're like those party animals who just won't go home. They ignore the signals that tell them to stop and keep multiplying out of control. These rebellious cells form tumors, which can damage nearby tissues and organs. If these troublemakers decide to spread or metastasize to other parts of the body, that's when things get even more serious. Now, cancer isn't just one disease, it's actually a whole family of over 100 different types. You've probably heard of some of the big ones: breast cancer, lung cancer, colon cancer. The list goes on. Each type has its own quirks and behaviors, but they all share that common thread of uncontrolled cell growth. Fun fact: did you know that there's a type of cancer called hairy cell leukemia? It gets its name because the cancer cells have tiny hair-like projections under a microscope. Let's zoom in on two of the most common cancers: breast cancer and lung cancer. Breast cancer, as you might guess, starts in the breast tissue. It's most common in women, but men can get it too. It's a bit like a weed growing in a garden. It can start small, but if left unchecked, it can spread and cause serious damage. That's why regular checkups and mammograms are so important for early detection. Lung cancer is the deadliest cancer worldwide, and smoking is the biggest culprit. But even non-smokers can get it, so don't think you're automatically in the clear if you've never touched a cigarette. It's like a fire that starts in your lungs and can spread to other parts of the body if it's not extinguished quickly. Symptoms like a cough that won't quit, chest pain, or shortness of breath should never be ignored. Get them checked out by a doctor ASAP. Fun fact: did you know that dogs are being trained to sniff out lung cancer? Their super sensitive noses can detect certain chemicals in the breath of people with lung cancer, even at very early stages. Okay, let's get real for a minute. Why does cancer happen? Well, there isn't a single answer. It's usually a combination of factors, kind of like a recipe gone wrong. Our genes play a role. Some people are born with genetic mutations that increase their risk, but our lifestyle choices and environmental exposures matter too. Things like smoking, unhealthy diets, lacks of exercise, and exposure to certain chemicals can all contribute to the recipe for cancer. But the good news is that we're not powerless against cancer. There's a lot we can do to reduce our risk and improve our chances of early detection. First and foremost, healthy lifestyle choices are key. That means eating a balanced diet rich in fruits, vegetables, and whole grains, staying active, maintaining a healthy weight, and avoiding smoking and excessive alcohol consumption. Early detection is the second key weapon. It's like having a security camera in your garden to catch those pesky weeds before they take over. Regular screenings like mammograms, colonoscopies, and skin checks are essential. They're not always the most fun things to do, but they can literally save your life by catching cancer early when it's most treatable. Fun fact: did you know that the PAP test, used to screen for cervical cancer, is named after George Papanicolaou, the doctor who developed it? Thanks to his invention, cervical cancer deaths have decreased dramatically. So let's break down the different types of cancer treatment. One of the most well-known is chemotherapy, or chemo for short. This treatment uses powerful drugs to kill cancer cells throughout the body. It's like a powerful storm sweeping through your system, taking out the bad guys along with some of the good. Chemo can be tough on the body, causing side effects like nausea, fatigue, and hair loss. But it can also be incredibly effective in shrinking tumors and even curing certain types of cancer. Fun fact: did you know that the oldest known cancer treatment dates back to ancient Egypt? The Ebers Papyrus, a medical document from around 1550 BC, describes using a primitive form of surgery to remove tumors. Another common treatment is radiation therapy. This uses high-energy radiation to damage cancer cells and stop them from growing. Think of it like a laser beam targeting those rogue cells with precision. Radiation can be delivered externally, through a machine outside the body, or internally, by placing radioactive material close to the tumor. It can cause side effects like skin irritation or fatigue, but it's a powerful weapon in the fight against cancer. Did you know that the first use of radiation therapy to treat cancer dates back to the late 1800s? Early radiation machines were quite primitive compared to today's sophisticated technology, but they paved the way for modern radiotherapy. Surgery is another important treatment option. It involves removing the tumor and sometimes surrounding tissue. It's like a skilled surgeon carefully extracting a weed from a garden, making sure to get all the roots. Surgery can be very effective in curing certain types of cancer, especially when the tumor is localized and hasn't spread. Now let's geek out for a bit on the latest breakthroughs in cancer research. Scientists are like detectives, constantly hunting for clues and developing new weapons to fight this disease. One promising area is immunotherapy. This is a revolutionary approach that harnesses your body's own immune system to fight cancer cells. It's like training your body's own army to recognize and destroy the enemy. Fun fact, the concept of immunotherapy dates back to the late 1800s, when a surgeon named William Coley noticed that some cancer patients who developed infections after surgery actually experienced tumor shrinkage. This observation led to the development of early immunotherapy techniques, and the field has advanced tremendously since then. Another exciting development is personalized medicine. This is where treatments are tailored to your specific cancer and genetic makeup. It's like having a custom-designed weapon that's specifically built to fight your cancer cells. This approach is showing great promise for improving outcomes and minimizing side effects. Another exciting development is personalized medicine. This is where treatments are tailored to each individual's specific cancer and genetic makeup. It's a bit like a custom-made suit, a perfect fit for you and your unique needs. This approach is showing great potential for improving outcomes and minimizing side effects. Fun fact, did you know that there are over 10,000 ongoing cancer clinical trials worldwide? These trials are testing everything from new drugs and therapies to innovative surgical techniques and supportive care approaches. But with every advancement comes new challenges. Cancer cells are sneaky, and they can develop resistance to treatments. That's why ongoing research is so important. Scientists are constantly working to understand how cancer cells adapt and evolve, so they can develop new strategies to stay one step ahead. Another challenge is making sure that everyone, regardless of their background or financial situation, has access to the latest and greatest treatments. This is a complex issue with no easy answers, but it's a conversation we need to keep having. So what can you do? Stay informed, educate yourself about cancer and the latest research. Talk to your doctor about screenings and risk factors. Support cancer research organizations, and if you're feeling passionate, advocate for policies that promote access to affordable, high-quality care for all. Fun fact, did you know that the color pink, often associated with breast cancer awareness, was chosen because it's considered a feminine color and breast cancer primarily affects women? However, men can get breast cancer too, so don't forget to spread awareness to the guys in your life. Remember, cancer may be a formidable opponent, but we're not backing down. With continued research, early detection, healthy lifestyle choices, and a whole lot of determination, we can beat this thing. Thanks for watching, everyone. If you have any questions or comments, please leave them below. And don't forget to like and subscribe for more health-related content. Take care of yourselves and each other.